Now I want to spend a little bit more time talking about that first indicator, our ability to monitor and protect our communities through our testing, our ability to do contact tracing, isolating and supporting those who are positive or who've been exposed. So one last reminder that we built these indicators around a goal, 4 goals really, and I want to remind you what they are. We want to ensure our ability to care for the sick within our hospitals. We want to prevent infection of those who are high risk for severe disease. We want to build the capacity to protect the health and well-being of the public, and we want to reduce the social, emotional, and economic disruptions that many of us are facing. So these indicators are really formed around these 4 goals. I want to spend a moment a little bit on our data. We have been telling you day over day our numbers in hospitals, in ICUs, and as we look at these over the last many weeks, especially since we've instituted the statewide stay-at-home order, we see ourselves tracking in what we call our range of stability. And this lower line is the number of ICU beds and vents that we are using across our system. This upper line is our total number of hospitalizations, both of those who have been confirmed to have COVID and those who we've suspected. And as we look at this trend line, you see we've had small peaks along the way, but we have generally stayed, this is since March 27th, we've stayed in this zone of stability, range of stability, that give us confidence that we are prepared to move forward with some of our modifications. And as you hear in the national media, conversations about where are your cases, where are your hospitalizations going, we really wanted to share with all Californians the data we've seen across the state that gives us confidence in moving in the directions that the governor laid out moments ago. I want to remind you a little bit more of the detail of our indicator 1. 2 of the key questions that we ask ourselves is how prepared is our state to test everyone who is symptomatic? And do we have the ability to identify contacts of those who are positive to reduce their further transmission? So what is contact tracing? When someone tests positive for COVID-19, we want to be able to identify those who've been in close contact with that person. And for each of those persons that we are contact tracing, we want to be able to contact them first. We want to be able to check their symptoms, offer testing, and recommend isolation to start, or quarantine to start, and isolation as necessary if they indeed test positive. So why is this important? It enables us to suppress the spread of the virus to avoid outbreaks. It is very important that as we identify somebody who's positive, we meet and contact their close contacts, that we're able to limit their chance of spreading COVID-19 in case they in fact are infected. And that, being able to do that, gives us the ability to first maintain the surge capacity that we've worked hard with our healthcare delivery partners, our labor partners over weeks to maintain, so that if we do have an increased number of people who are COVID positive, that our systems are prepared and able to care for them. It also allows us to modify our stay-at-home order because we have more confidence that when somebody is infected or when somebody is exposed in our community, that they are going to join us in trying to limit the spread by staying home and isolating or quarantining. So we have looked at many of these indicators, and we've developed a series of work streams. For indicator 1, we first talk about accelerating equitable COVID-19 testing. The governor laid out many great strides we've taken on testing. We've made improvements on our ability to obtain the supplies, whether it's swabs or viral transport media, our ability to work with partners. The governor mentioned Abbott. We've been in great conversations with LabCorp and Quest as important national commercial lab leaders to ensure that capacity that they have today is available to Californians. We are at the state level through our testing task force, coordinating the connection of those supplies with the new testing sites that the governor mentioned, and many more that we hope to stand up both at the local level and with state leadership to ensure that we have all of the places available that those who need a test and even those who want a test can be tested to provide not just the public health reassurance, but also the personal reassurance that we can continue and resume certain activities that we have delayed up until now. We know that the governor mentioned the number 60,000 to 80,000. The way we get to that number is both through national conversations on a number of tests per 100,000 people. The governor mentioned 152 tests per 100,000 Californians gets us just above 60,000 tests a day that we would need. We additionally look at it from the perspective of, well, if we expect a slight increase in the number of cases to somewhere between 2,000 and 3,000 per day, that then we understand that on average, each of those has 10 close contacts, that we need to create the capacity to test nearly 30,000 people, maybe even more, 35,000 people as a result of our contact tracing, and then additionally to establish 25,000 tests to maintain and support the healthcare delivery system, our clinics, and many of those who are working in essential areas across the state, whether those are healthcare delivery sectors like skilled nursing facilities or our grocery stores and our transportation efforts. We want to make sure that those folks, those who go in to serve our communities are protected, and we know we're able to tell them on a regular basis whether they're positive, whether they've been exposed, so they can not only do their job in a responsible and confident way, but they can also protect their families when they go home. And then we know that every year around fall, winter, and early spring, we experience a surge of symptoms of the common cold and the flu. And in this day and age, we have to ask the question, is that the common cold or is it COVID-19? And ensuring that we have increased capacity during those months to test more people gives us our range between 60 and 80,000 a day. Those are of the PCR tests. As the governor mentioned, we are learning more and more about serologic testing. We are confident that as that technology and modality develops, that California will be one of the first to adapt it and scale it across our state. First to use it for our surveillance efforts to understand how many people in our communities have been infected, and then later, as we are more confident that the antibodies that we're testing for actually neutralize, if they do, neutralize the virus, to be able to say somebody has been exposed and they're protected to a certain degree. But I caution you that we are not there yet, that we are working with our academic partners and our lab partners to move that forward in responsible and yet accelerated ways. And as soon as we are confident with how to use that modality in California, we will communicate that clearly and assertively. We also talked a bit about establishing our contact tracing workforce, develop the isolation and quarantine protocols and supports, and deploy our data management system and tools. These are our 4 work streams for Indicator 1. To go just one level deeper, accelerate equitable testing. Today, you heard the governor re-articulate our goal for the end of April to hit 25,000 tests a day. We are at 16,000, just a little bit north of 16,000 a day at the moment, with the goal and our confidence that we will be able to accelerate towards 25,000. That is on our way to getting to that 60 to 80,000 a day. Establish between 80 and 100 new testing sites, and these are sites not in the common areas, not in the places where we already have a significant degree of testing, but in what we're calling testing deserts. Places that, because they're a bit more remote, don't have as many testing sites that have come together at the local level, and then also from a very strong equity lens that we put these in communities that have shouldered the burden of COVID-19 in a disproportionately high way. Those are our brown and black communities. Those are lower income communities where people are still going to essential work and maybe don't have as much of the PPE that we wish they had, to ensure that that they are knowledgeable of their status with COVID-19 and that they can continue to do their job and protect their family well. And then we are continuing to work with our new high throughput sites, our hubs, so that their capacity on their instruments is shared broadly, not just with their hospitals and clinics, but beyond with the skilled nursing facilities that surround them, whether that's in San Diego or in the Sacramento area, really connecting all of these facilities to one of these testing hubs so that those specimens can be processed. It is no small announcement that we have a promise to have swabs here this week. Those 100,000 swabs are 100,000 tests. That's 100,000 people who can hopefully receive confidence of their status and understanding how we support our communities as we consider modifying that stay-at-home order.